Okay, let's look at some of the anterior muscles of the torso, just a few that we can see on the neck and chest. The first one I want to show you originates from both the sternum and the clavicle, and if I follow the orientation of those fibers, they'll fuse together ultimately and insert into the mastoid process of the temporal bone. So I've got sternocleidomastoid, those words describing the origin and the insertion. If I only contract one of those sternocleidomastoids, it'll cause lateral flexion, and I'll turn my head to the opposite side. So if I contract this right one, you'll end up turning your head to the left, and you can feel that on yourself when you do it. If I come to the other side, I take the sternocleidomastoid off, and now I get a little bit deeper, and I can see a group of 3 muscles. It's somewhat hard to depict on this guy, but you can see it also on our little man model in lab. There's 3 muscles. I have one to the front, one to the middle, and then one to the back. Collectively, those 3 muscles come from the transverse processes of the cervical spine, and they're going to work their way down and insert into the top 2 ribs typically. Those as a group are referred to as the scalenes. So you would have the anterior scalene, the middle scalene, and the posterior scalene. For a lab practical, I'd be more inclined to show you them as a group because it is somewhat hard to differentiate them, but if you look close, you can find it, okay? When we get to the shoulder and the chest, I'm going to swing back over to the right side. Big giant muscle that's going to originate from the clavicle and the scapula is referred to as the deltoid, named for the triangular shape orientation of the muscle. So if I contract the anterior portion of the deltoid, it'll flex the shoulder. If I contract the lateral portion, it'll abduct the shoulder, or if I contract the posterior portion, it will help to extend the shoulder. When I take a look at the torso from the front, anatomically, the right, we're looking at superficial stuff, and the left, we're looking at more deeper structures. So big giant muscle that lies on the front of the chest with origin coming off of the sternum and the clavicle and insertion over into the humerus, that's going to be our pectoralis major. So just notice the orientations of the fibers when you're studying and imagine those fibers come together and contract. It's going to help flex the arm and it's going to help adduct the shoulder. If I take the pectoralis major off and I go deep to it, on the left-hand side, I'll see this muscle. This muscle is the pectoralis minor. It's going to come from ribs 3, 4, and 5 typically, and work its way up to insert into the coracoid process of the scapula. So since the origin is generally more stable, if this contracts and it's pulling on the coracoid process, it's going to protract or bring the scapula forward. If I stabilize my shoulder and I contract and pull the ribs upward in this direction, it'll help with elevation of the ribs. So we'll see next semester in A&P2, we call this an accessory muscle of respiration because it helps to increase the rib cage, okay? If we come down here in the abdomen, I have 4 sets of abdominal muscles, but I can only show you 3 of them on this model. The 4th one we can look at on our little man, where we can take the abdomen off and look from the inside. So the first thing that I see going up the front is what would give you your 6-pack, okay? And this, of course, these are bilateral. This is your rectus abdominis. Contraction of the rectus abdominis, because the fibers are in this direction, will allow for trunk flexion. Then I have 2 muscles that we call obliques. I have an internal oblique and an external oblique. The right side of the model is superficial, so what we're seeing here is the more external muscle. The left side of the model is deeper, and we're looking at the internals. So one of the ways that I remember them, if you can see the orientation of these fibers, the fibers are all oriented in this direction. If this person had their hands going in their pocket, their fingers are oriented like they're going hands in pockets. That's how we know it's external. If I look at the internal oblique, the fibers are going in the opposite direction, opposite, perpendicular to hands in pockets, okay? Both sets of obliques are going to aid with flexion of the trunk, and they're both going to allow for lateral rotation. Then, because I'm dealing with superficial muscles that insert into flat fascia, we call this fascial appearance an aponeurosis. So the white connective tissue that accepts the external oblique is going to be the external oblique aponeurosis. You're going to have some internal oblique aponeurosis. Between the bellies of the rectus abdominis, you have tendinous inscriptions. And then a little tough to see because the right side is all covered with this connective tissue, but there's a line that runs right up the center, connecting both sides, the left and right side of the rectus abdominis, and that we refer to as the linea alba. Okay? So staying with that pattern of hands in pockets or perpendicular to that, if I notice on this model I have my ribs exposed, very, very hard to see the striation pattern. It's a little bit easier on our little man model, but there's enough here that we can see. Do you notice if this torso's left hand was putting his hand in his pockets, the fibers would be oriented in this direction, and that's what we see. This muscle that lies between the ribs, with its fibers oriented from superolateral to infromedial, those are referred to as your external intercostals, and you can see them throughout between the ribs. My external intercostals are oriented in this direction. My internals are deeper and the fibers are perpendicular to them. So deep to the external intercostals, I can find the internal intercostals, and those are fairly evident. The last thing we can kind of see here from the anterior is I have this network of muscles, and if I look at the network of muscles, their origin is on the ribs. And if you notice the origin, the presentation of the muscles, it's jagged. It looks like perhaps a serrated knife would look, and we refer to this muscle as the serratus. Our broad muscle that originates on the ribs, it's going to dive underneath the scapula and actually insert in the medial border of the scapula. This is called the serratus anterior. And when it contracts, since it goes all the way around the back of the scapula, it's going to pull the scapula forward, and again we call that protraction.